Hi, my name is Markeisha Johnson, and I am doing my presentation on family therapy with clients dealing with grief and loss. I chose to do my presentation on this topic just because of my own personal experiences with grief and loss. I recently lost my father in July of 2018, and I know that at any given point, I will be working with clients who may be experiencing the same thing. Actually, I do have a client that I was working with who lost a child. So being able to check my countertransference and work through my own grief and loss will help me deal with clients who may be experiencing the same thing. So I felt that this presentation would help me through my own process as well as other clients that I may be dealing with in the future and currently. There are four different types of grief that I will be discussing in this presentation. We have complicated grief, acute grief, integrated grief, and delayed grief. The first type of grief that I'll be discussing is complicated grief. And complicated grief is a condition that occurs when something impedes the process of adapting to a loss. So for complicated grief, some of the symptoms that an individual may be experiencing is intense and prolonged yearning, longing and sorrow, frequent insistent thoughts of the deceased, and difficulty accepting the painful reality of the death. Now, with complicated grief, it can be categorized or classified as a mental health disorder. So I mentioned about four different symptoms, but however, there are more intense symptoms that a person may have who is diagnosed with complicated grief. They may feel guilty related to the death of the deceased. Also, self-criticism is a big one, which is related to the loss of that person or that loved one. A person who may be experiencing complicated grief may have suicidal thoughts of not wanting to live without the deceased or a wish to rejoin that deceased loved one, as well as avoidance of certain situations and people as it relates to them being reminded of that particular loss. The second type of grief is acute grief. And acute grief is the initial response, often intense and highly emotional, dominating our mind, as well as disruptive. A definite syndrome characterized by the psychological and somatic symptoms consists of a sensation of somatic distress that occurs in waves lasting 20 minutes to an hour, images of this deceased in dreams, sometimes feelings of guilt, disorientation behavior, some, for example, resentlessness, insomnia, inability to concentrate, as well as an inability to perform daily tasks. An initial period of acute grief typically evolves naturally into integrated grief. The next type of grief is integrated grief. Typically, at this stage of grief, the person has come to the realization that the loved one is gone, and this is more so a positive stage of grief. So, it's a permanent response after adaptation to the loss, in which satisfaction in ongoing life is renewed. So, thoughts or memories of the deceased are no longer as preoccupying or disabling. So they're not being, for lack of a better term, people who are in this stage of grief, they're not being consumed with so many negative thoughts or being preoccupied by that particular loved one being deceased. They also, the individual finds a way of staying connected to the deceased without them being physically present. So, for instance, they know that their loved one is gone, and they're no longer at the stage where they need them to be physically here. So they have come to terms with the reality, which is their loved one is gone and they won't see them again. So they understand that, and they're okay with the memories of that person. In this stage of integrated grief, there may be times when acute grief reemerges. However, this is typically around holidays or after another loss. So for me, although I just lost my dad in July, when his birthday when his birthday came around in October, it brought up those memories. It brought up that I was triggered. Like I thought about, him being here and him not being here for his birthday. So certain holidays, like Father's Day, is coming around the corner in June, and that will probably be a trigger for me, even though I may be at the stage of integrated grief where I understand that he is no longer here. I may go back to acute grief when it's around his birthday or holiday, or even if I see somebody else, or I understand that somebody else lost a loved one, that triggers me as well. So other people's death can be a trigger and can bring you back to the acute grief. But that's sometimes only for a short period of time, most of the time only around those holidays. Another stage of grief is delayed grief. Delayed grief is grief that is postponed and resurfaces at a later time. Oftentimes, people who are in a stage of delayed grief, they typically suppress or ignore the grief, and that will most likely affect other parts of their well-being. Here's a great example. So after my dad passed away, I went and saw a therapist. I did individual therapy with grief and loss component, and my therapist had praised me for coming so soon, right after I lost my dad. She said it's good to get the help that I needed quickly so that I can go over, finish and get my grief out of the way and progress through the different stages of grief. She had a client who lost a child. However, he did not grieve at that time. He waited 20 years later to grieve. So that's a prime example of delayed grief. Usually when people are in a stage of delayed grief, they're busy doing other things. Like they're so busy because when you lose a loved one, business still has to be handled. You still have to plan a funeral. You have to take care of belongings. Life does not stop when a person dies. And sometimes people have to be strong for other people. So typically those who have delayed grief, they don't think that they can grieve at this time because they have to be strong for another person. Maybe they lost a wife or a husband and they have to be strong for the kids, so they can't really grieve for themselves. And then it happens later on in life when they are now being triggered by something and it's affecting their well-being, and now they're grieving when they should have grieved or could have grieved 20 years ago, if that makes sense. Bereavement. Bereavement is a specific type of grief related to someone dying. About 7% of bereaved older adults, however, will develop the mental health condition of complicated grief. And we will talk more so about complicated grief and its treatment in subsequent slides. Older adults experience bereavement at a much higher rate than younger adults. And research suggests that over 70% of older adults experience bereavement in a 2.5-year period, in a 2.5-year period. There are 4 components of grief that I want to talk about. The first component of grief is separation distress. And a person who is experiencing separation distress typically has symptoms of sadness, anxiety, pain, helplessness, anger, shame, yearning, and loneliness. Then we have traumatic distress. Traumatic distress is when you're in a state of disbelief and shock. Intrusions and efforts to avoid intrusions and the spike of emotions are produced. So another example of shock. So when my father passed away, it was unexpected. It wasn't like I was prepared for it. It was an unexpected death. So when I found out, I went through these symptoms. I was shocked. I was like, I couldn't believe it. I was in a state of disbelief. Like I could not, it did not fathom to me that he was gone. So you have those different stages of grief. Then you have guilt, remorse, and regrets. So people who typically experience this stage or this component of grief, when you feel guilty, you think, okay, maybe it's my fault. If I would have done this, he would still be alive. Or you have regrets. Maybe when the loved one died, you guys weren't on the best of terms. You didn't get a chance to make peace. You didn't get a chance to be on a better term with that person before that person passed away. So you have all these different emotions and feelings that you wish you could have changed. And then we have social withdrawal. Social withdrawal typically is kind of self-explanatory. The person who experiencing this component of grief, they withdraw from social settings. They are more so in isolation. They don't want to be around people, or they don't want to do anything. Like, they want to just be left alone and by themselves. And it's okay. It's okay to be experiencing these different types of grief, because that's the stage. That is how you're able to express, and that is how you're able to show your emotion during these different stages. So I provided you with a definition of grief. We talked about bereavement. We talked about the different types of grief. And then we also talked about the different components of grief. Now I'm going to focus my attention on different treatments for grief. So family-focused grief therapy. This is usually aimed for families, and it focuses on families who are experiencing grief, and is to reduce the morbid effects of grief amongst families at risk of poor psychosocial outcome. So family-focused grief therapy is brief, it's focused, and it's time-limited intervention, which typically comprises of 4 to 8 sessions of 90-minute intervals for approximately 9 to 18 months, just depending on where you're at in your treatment plans. And if you've accomplished your goals, it can be more or less between 9 and 18 months. Family-focused grief therapy aims to prevent the complications of bereavement by enhancing the functioning of the family through explanation of its cohesion, communication of thoughts and feelings, and handling of conflict. There are 3 phases of family-focused grief therapy. The first phase is assessment, and that is typically between 1 and 2 weekly sessions, and it concentrates on identifying issues and concerns that are relevant to the specific family and on devising a plan to deal with them. Then you have phase 2, which is the intervention phase, and that is usually between 2 to 4 sessions, and it focuses on the agreed concerns. Then we have phase 3, which is the termination phase, and that is between 1 to 2 sessions. And in the termination phase, it consolidates gains and confronts the end of therapy. So the frequency and number of sessions in each phase are modified to meet the needs of each family. Each family is different, so each phase will be different as far as the duration. So you just have to look at it based on what the family needs are at that time. Another type of treatment is complicated grief treatment. So we talked a little bit about what complicated grief treatment is, which can be classified as a mental health disorder. So those individuals who are experiencing complicated grief, their symptoms are more intense. So for treatment, there is CGT, which is complicated grief treatment. The central premise of CGT is that bereavement is a universal life event, and that grief and adaptation to loss are natural inborn responses. Complicated grief can be reliably detected with standardized measures such as inventory of complicated grief. And if you want to assess someone for grief, you can use this type of measurement tool, and based on how they score, that can determine if they meet the standards of CG. Complicated grief treatment is a structured intervention that is typically administered in 6 weekly sessions organized in 4 phases. Phase 1 is getting started. Phase 2 is core revisiting sequence. Phase 3, mid-course review, and phase 4, closing sequence. There are 7 core components of CGT. 1, sharing information. 2, promoting self-observation. 3, rebuilding connection. 4, advancing aspirational goals and rewarding activities. 5, revisiting the story of the deaf. 6, revisiting a world changed by loss. And 7, fostering continuing bonds through living memories. This concludes my presentation. I hope that you guys understood and were able to receive some valuable information if you're going through grief and loss, or if you have clients who may be experiencing grief and loss and you wanted to know what kinds of treatments that you can provide for them. This presentation definitely helped me through my grief and loss process, and it also helped me to do some more so self-reflection so that I can recognize when I'm experiencing counter transference, or if I am, meeting with a client who may be experiencing the same things as me, I'm not easily triggered. So thank you guys for listening. Please comment. I would love to engage in discussion. If you have any questions or concerns, please feel free to leave them. Thank you. Have a good rest of your night. Hi, my name is Markeisha Johnson, and my video presentation will be on family therapy with clients dealing with grief and loss. I decided to choose this topic because I'm experiencing grief and loss from losing my father back in July of 2018. I thought this presentation would help me cope with some grief that I'm currently dealing with. Also, when dealing with clients who may be experiencing the same thing as the clinician, it's important to understand countertransference so that your issues would not be put on to the client and vice versa. What is grief? Well, in the family system sense, grief is viewed as a multidimensional process of reconceptualization of reality focused on regaining stability and meaning after a loss, with family members using their ongoing relationship with each other to engage in that process. And that is quoted from Gilbert. So, grief can be grieving over a loss of anything. It doesn't necessarily have to be a death, but in the terms of this presentation, we're going to speak more so about death, but it can be a loss of multiple different things, a job, a house. That's kind of like the difference between grief and bereavement. In this presentation, I would discuss 4 different types of grief: complicated grief, acute grief, integrated grief, and delayed grief. Complicated grief is a condition that occurs when something impedes the process of adapting to a loss. So some of the symptoms that comes from complicated grief is intense and prolonged yearning, longing and sorrow, frequent insistent thoughts of the deceased, and difficulty accepting the painful reality of the death. So those are some of the symptoms that I talked about. There are several different other ones. Complicated grief can be classified as a mental health disorder because of the severity of the grief that comes along with it. So, for instance, individuals who experience complicated grief oftentimes have self-criticism relating to the loss that they experience. They also sometimes have suicidal thoughts of not wanting to live without the deceased or a wish to rejoin the deceased. Also, avoidance of situations and people related to reminders of the loss. The second type of grief is acute grief. Acute grief is the initial response, often intense and highly emotional, dominating our mind and can oftentimes be very disruptive. A definite syndrome characterized by psychological and somatic symptoms, which includes sensation of somatic distress that occur in waves lasting 20 minutes to an hour. Also, oftentimes, people who experience acute grief have images of the deceased in their dreams. They have feelings of guilt and disorientation behavior. For example, resentlessness, insomnia, inability to concentrate, and also the inability to perform daily activities. An initial period of acute grief evolves naturally into an integrated grief, which we will talk about in the next slide. Integrated grief. Integrated grief is a permanent response after adaptation to the loss in which satisfaction in ongoing life is renewed. This is more so the stage where you're beginning to recover from the grief and loss of a loved one. So it's more of a positive stage. The thoughts or memories of the deceased are no longer as preoccupying or disabling. So you're not consumed with the negative thoughts and sadness of the loss of your loved one. You've come to terms with it and you're able to move on successfully. The individual finds a way of staying connected to the deceased without their physical presence. So you know that the deceased is gone, so they don't have to be here for you to understand and have them in your presence. Like you sense their spirit and their memories will help you to move on and get over that stage of grief. There also may be times when acute grief reemerges. However, this is typically around holidays or after another loss. So for me, losing my dad recently, it was very difficult for me. It's still difficult for me to get over, but I've come to terms that he's not here. However, when I experience another loss or if I hear of someone else dying, it kind of triggers me and it brings me back to that feeling of acute grief, if that makes sense. Delayed grief. Delayed grief is considered grief that is postponed, however, resurfaces at a later time. So those individuals who are in a stage of delayed grief, they oftentimes are suppressing or ignoring their grief, which will most likely affect other parts of their well-being. For instance, I went to family therapy or I went to individual therapy to help me with grief and loss. My therapist had informed me that it was great that I came to therapy so soon after I experienced such an incredible loss, because she had a client whose daughter passed away. However, he didn't start grieving until 20 years later. So those who experience delayed grief, oftentimes when you're dealing with a sudden death, there is business that still has to be handled. Planning of a funeral, trying to stay strong for other family members, so you don't necessarily have the time or the energy to grieve. But however, if you don't grieve at that time, you're gonna grieve later on down the road. It's inevitable. So 20 years later, this man grieved because he didn't experience grief when it first happened. So that is an example of delayed grief. Bereavement. As mentioned earlier, bereavement is when one is experiencing it's a specific type of grief related to someone dying. So bereavement is when you actually lose a loved one through death. About 7% of bereaved older adults, however, will develop the mental health condition of complicated grief. And we'll talk more about complicated grief and the treatment for that. Older adults experience bereavement at a much higher rate than younger adults, and research suggests that over 70% of older adults experience bereavement in a 2.5-year period. So I will talk about four different components of grief. There is separation distress, which some examples of that considered is sadness, anxiety, pain, hopelessness, anger, shame, yearning, and loneliness. Then you have traumatic distress. And with traumatic distress, you're more so in a state of disbelief and shock. Like you can't believe this is happening. Intrusions and efforts to avoid intrusions and the spike of emotions that sort of produce when you are in the state of traumatic distress. Then you have guilt, remorse, and regrets. Maybe you didn't say goodbyes, or maybe you weren't in a good place with a loved one when he passed away. So now you have feelings of guilt, like, oh, I should have did this, I should have done that. So the last moments that you can remember between you and the loved one was not of good ones. So people who experience like guilt and remorse and regrets more so are in that stage, and they didn't end well with the loved one before they passed away. Then you have social withdrawal. And social withdrawal basically is self-explanatory. You withdraw from social settings, like you're in a state where you just want to be left alone. You're in isolation. You don't want to be bothered with people. That's your way of dealing with your grief. So now that I explained the definition of grief and we talked about the different types of grief and the different stages of grief, we're going to move forward to the types of treatment that you can receive for grief and loss. So family-focused grief therapy. The aim of family-focused grief therapy is to reduce the morbid effects of grief amongst families at risk of poor psychosocial outcome. So this is more so like the family therapy, but with a grief and loss component. It's brief, it's focused, and it's time limited. It's an intervention that typically comprises between 4 to 8 sessions of 90-minute intervals for about 9 to 18 months, depending on if you're achieving the goals that the therapist or clinician has set forth for you. Family-focused grief therapy also aims to prevent the complications of bereavement by enhancing the functioning of the family through explanation of its cohesion, communication of thoughts and feelings, and the handling of conflict. There are 3 phases in family-focused grief therapy. Phase 1 is the assessment phase, and that is 1 to 2 sessions, which concentrates on identifying issues and concerns relevant to the specific family and on devising a plan to deal with them. Then we have phase 2, which is the intervention phase, which is typically between 2 to 4 sessions, and that focuses on the agreed concerns. Then we have phase 3, which is the termination phase, which is 1 to 2 sessions, and that consolidates gains and confronts the end of therapy. The frequency and number of sessions in each phase are modified to meet the needs of each family. Complicated grief treatment is another form of treatment that individuals who are experiencing significant grief and loss may benefit from. The central premise of complicated grief treatment is that bereavement is a universal life event and that grief and adaptation to loss are natural inborn responses. Complicated grief can be reliably detected with standardized measures, such as the Inventory of Complicated Grief. And this tool can be used to determine whether or not a person meets the standards for complicated grief. CGT is a structured intervention that is typically administered in 16 weekly sessions organized in 4 separate phases. Phase 1 is getting started. Phase 2 is the core revisiting sequence. Phase 3 is the mid-course review, and Phase 4 is the closing session. There are 7 core components of complicated grief treatment. 1, sharing information. 2, promoting self-observation. 3, rebuilding connection. 4, advancing aspirational goals and rewarding activities. 5, revisiting the story of the death. 6, revisiting a world changed by loss. And 7, fostering continuing bonds through living memories. This ends my presentation. I listed some references in which I obtained my information from. I hope this presentation can help someone who may be experiencing grief and loss, and I hope this can help dealing with a client who experienced the same thing. I know this has helped me drastically through my own grieving process, as well as helping me understand individuals who I may work with who experience grief and loss, so that I'm more so not triggered and I won't be experiencing. I know I will be experiencing countertransference if I have a client who's experiencing kind of the same things that I am, but this presentation is supposed to, and it has helped me through that process and helped me become a better clinician and help those who may be going through the same things that I'm going through. So feel free to comment, ask me any questions. I would love to engage in discussion regarding my presentation. Have a great night. Thank you.